Hello, I'm Dr. Caleb Sterling. I want to talk to you today about something that changes dramatically after you turn 60. Something your doctor might not be emphasizing enough, and something that could literally transform how you feel every single day for the rest of your life. I'm talking about one specific nutrient that your body starts struggling to absorb around age 60. And here's the thing, even if you think you're getting plenty of it in your diet, your body might not actually be using it the way it did when you were younger. The nutrient is B12, or cobalamin. And I know that might sound a little unsexy or boring, but stick with me, because the effects of getting this wrong are anything but boring. Over the last 20 years of clinical practice, I've seen B12 deficiency wreak absolute havoc on people over 60. I've watched patients struggle with confusion and brain fog, thinking they were developing dementia. I've seen people dealing with chronic fatigue that made them feel like they were moving through life in slow motion. I've witnessed the joint pain, the tingling in their hands and feet, the mood changes, the memory problems. And then we correct their B12 level and they tell me, Dr. Sterling, I feel like myself again. So today, I want to walk you through exactly why your body struggles with B12 after 60, what the real consequences are if you don't address it, and most importantly, what you can actually do about it. Let's start with understanding why this happens. When you're young, your stomach is absolutely a B12 absorbing machine. You eat food that contains B12, usually from animal products like meat, fish, eggs, and dairy. Your stomach acid breaks down that food, and then a special protein called intrinsic factor grabs onto the B12 and helps your small intestine absorb it. It's a beautiful system. But here's what happens over time. As you get older, your stomach starts producing less acid. This is completely normal, but it has a major consequence. Without enough stomach acid, your food doesn't break down properly, and the B12 in that food doesn't separate from the proteins it's bound to. So even though you're eating foods with B12, your body can't actually extract it. It's like having money in the bank, but no way to access it. At the same time, your stomach lining changes. You produce less of that intrinsic factor I mentioned, and some people develop something called atrophic gastritis, which is basically inflammation of the stomach lining from bacteria or from your own immune system. All of these changes add up to a system that's working much less efficiently. Now, here's something that shocked me when I first learned it. Most doctors don't automatically check for B12 deficiency. We check cholesterol, we check blood sugar, we check blood pressure, but B12 often slips through the cracks. And that's a real problem, because B12 deficiency develops slowly and quietly. By the time you notice symptoms, you've often been deficient for quite a while. So what are these symptoms? Well, they're sneakier than you'd think. In the early stages, you might just feel a little more tired than usual. Not the crushing exhaustion of the flu, but just a steady sense of fatigue that doesn't really go away with rest. You might feel a little brain foggy, like you're trying to focus, but there's static in your mind. As the deficiency gets worse, you start noticing real neurological symptoms, a tingling or numbness in your hands and feet. We call this paresthesia. It usually starts in your hands and can progress to your feet. You might feel weak. Your balance might get worse. And here's something really important. If B12 deficiency goes untreated for too long, some of this nerve damage can become permanent. That's not meant to scare you. It's meant to motivate you to get tested. You might also experience mood changes, depression, anxiety, irritability. You might get confused more easily. You might feel disoriented. Some people describe feeling like they're in a fog. And some of my patients have told me they felt like they were developing Alzheimer's disease, only to have all those cognitive symptoms clear up when we treated the B12 deficiency. Other people experience muscle weakness, or they feel physically clumsy in a way that's new for them. Some develop a smooth, bright red tongue. Others complain of constipation that doesn't respond to normal interventions. And because many of these symptoms overlap with depression, normal aging, or other conditions, B12 deficiency is often completely missed. Now let me be clear. Not everyone over 60 automatically develops B12 deficiency. But the research is pretty striking. Studies show that between 10 and 30% of people over 60 have some level of B12 deficiency. That means if you're over 60, there's a real chance this is relevant to you right now. Who's at even higher risk? Well, if you take metformin, a common diabetes medication, you're at higher risk. If you take proton pump inhibitors, those are medications for heartburn and acid reflux, your risk goes way up. If you've had stomach surgery, if you have inflammatory bowel disease like Crohn's or ulcerative colitis, if you have celiac disease, if you're vegetarian or vegan, you're at higher risk because plant-based foods
don't naturally contain B12.
Let me explain why B12 is so critical to your body. It does several essential jobs. First, it's crucial for making new DNA and keeping your cells dividing properly. When you don't have enough B12, cell division gets messed up. This is particularly important in rapidly dividing cells like your red blood cells. That's why B12 deficiency causes a type of anemia called megaloblastic anemia. Second, B12 is essential for maintaining your myelin sheath. You've probably heard of myelin. It's the protective coating around your nerves. Think of it like the insulation around an electrical wire. Without proper B12, that insulation deteriorates and your nerves stop working properly. This is why nerve symptoms are such a big part of B12 deficiency. Third, B12 helps regulate homocysteine, an amino acid in your blood. High homocysteine is associated with increased cardiovascular risk and increased dementia risk. If your B12 is low, your homocysteine goes up. So maintaining good B12 levels is actually protective for your brain and your heart. Fourth, B12 is absolutely essential for energy production. Your body needs B12 to convert the food you eat into usable energy. Without it, you feel exhausted, even if you're sleeping fine. And finally, B12 supports cognitive function directly. It helps with memory, concentration, and mental clarity. If you're struggling with those, low B12 could absolutely be the culprit. So how do you know if you have B12 deficiency? The most straightforward way is to get your blood tested. Your doctor can order a serum B12 test. Typically, anything below 200 picograms per milliliter is considered deficient, and between 200 and 300 is borderline. But here's something important. Some people have symptoms of B12 deficiency even when their serum B12 is in the normal range. This can happen because serum B12 doesn't tell you how much B12 your body can actually use. So if you have symptoms consistent with B12 deficiency, even if your serum B12 is normal, ask your doctor about doing additional tests like methylmalonic acid or homocysteine levels. Now, how do you address this? If you're deficient, there are really effective solutions. The gold standard treatment is B12 injections. This is because if your stomach can't absorb B12 from food, it usually can't absorb it from supplements either. An injection bypasses the absorption problem entirely and puts B12 directly into your bloodstream. The typical starting regimen is injections every month, though some people need them more frequently. The good news is that B12 injections are safe, inexpensive, and incredibly effective. Some people ask me about sublingual B12, the kind that dissolves under your tongue. This can work for some people because the tissue under your tongue can absorb B12 directly, but it's not as reliable as injections. If you're going to try sublingual, you need to stay under medical supervision and get your levels tested to make sure it's actually working. There's also nasal B12 spray, which works similarly to sublingual. It bypasses the normal absorption pathway and lets the tissue absorb B12 directly. Again, it can work, but it's not as reliable as injections. Some people try taking oral B12 supplements, thinking that more of it will be absorbed. The math doesn't really work out that way. If your stomach can't absorb B12, taking more oral B12 doesn't solve the problem. Now, here's something I want to emphasize. If you're deficient, treating this is not a luxury. This is basic healthcare. And if your doctor seems hesitant about giving you B12 injections, I'd encourage you to advocate for yourself. The injections are safe, they're not expensive, and they work. There's no downside to trying them. Once you start treatment, when do you feel better? Well, it varies. Some people feel different almost immediately. Their energy comes back, the brain fog lifts. For others, it takes a few weeks. And sometimes, if there's been nerve damage, recovery takes longer. Some of the nerve symptoms improve gradually over weeks and months. And again, if nerve damage has been going on for a very long time, some of that damage might be permanent. This is why early detection is so important. If you're over 60, you shouldn't wait until you have severe symptoms. You should ask your doctor to check your B12 level. It's a simple blood test, it's inexpensive, and it could change your life. Let me tell you about one of my patients, Margaret. She was 67, and she came to me complaining that she couldn't remember things anymore. She was worried about dementia. She'd had to leave a pot on the stove recently and forget about it. She was struggling at work because she couldn't concentrate. She felt tired all the time, even after sleeping. Her family was getting concerned. She'd seen a neurologist, a psychiatrist, and another primary care doctor, and nobody had found anything wrong. I checked her B12 level as part of a standard workup. It was 185, just slightly below normal. I prescribed monthly B12 injections. 6 weeks later, Margaret came back and told me that the fog had lifted. She was sleeping better. Her memory was sharper. She felt like herself again. Her family noticed the difference too. That's what B12 can do. Now, once you start B12 supplementation, how long do you need it? For most people over 60 who are deficient due to absorption problems, it's going to be lifelong. Your stomach acid isn't going to magically come back, so this becomes part of your regular healthcare maintenance. Some people get injections monthly, some get them every 3 months. Your doctor will figure out what interval works best for you based on how you feel and what your blood levels show. Let me also address the prevention angle. Can you prevent B12 deficiency? Well, you can be strategic about it. Even though your stomach can't absorb B12 from food as efficiently as it used to, eating foods rich in B12 is still worthwhile. Animal products have natural B12, so do fortified cereals and nutritional yeast. You can also ask your doctor about supplementation before you become deficient. Some doctors recommend that people over 60 take a B12 supplement or eat fortified B12 foods as a preventive measure. But I want to be realistic. If you have the absorption issues that come with aging, diet alone usually isn't enough. This is where medical intervention becomes important. I also want to touch on something important. Excess B12 isn't really a concern. B12 is water-soluble, which means your body excretes what it doesn't use. You can't overdose on B12, so there's no risk in treating a deficiency aggressively. Now, let me bring this back to the bigger picture. You're over 60. Your body is changing. It's not what it used to be, and that's okay. But it means you need to be more proactive about healthcare. You need to understand how your aging body works. You need to ask your doctor about B12. You need to advocate for yourself. Here's what I want you to take away from this conversation. First, B12 deficiency is common in people over 60, but it's often undiagnosed. Second, the symptoms can mimic other serious conditions like dementia, depression, or just normal aging. Third, the treatment is simple, safe, and highly effective. And fourth, getting your B12 levels checked is something you should do, especially if you have any of the symptoms I described. Don't assume that the fatigue, the brain fog, the memory problems, or the tingling in your hands is just what happens when you get older. Get tested. Take control of your health. Because when your B12 is optimized, you feel better. You think more clearly. You have more energy. You're more engaged with your life. And at 60 and beyond, that makes all the difference. If you're watching this and you're over 60, I want to challenge you to schedule an appointment with your doctor this week. Ask them to check your B12 level. Bring this conversation up. Share what you've learned. And if your doctor finds that you're deficient, follow through with treatment. Don't let this slip through the cracks. And if you're not over 60 yet, but you have parents or grandparents who are, share this video with them. Have the conversation. Help them get tested. Because the stakes are high. Your health at 70 and 80 depends on decisions you're making now. Thank you so much for watching. Please like this video if you found it helpful. Subscribe to the channel so you don't miss future health education content. And in the comments, let me know if you have questions about B12 or your own health concerns. I read as many